What if I told you that in the time it takes you to watch this video, over 20,000 people worldwide will contract a sexually transmitted infection? That's not a typo. More than 1 million people acquire an STI every single day globally. And here's what makes this truly alarming. Most of them don't even know it. I'm talking about a hidden global health crisis that affects every country, every community, and potentially someone you know. Let's put this pandemic in perspective. Every year, there are 374 million new STI infections worldwide. That's Chlamydia leading with 129 million cases, Gonorrhea with 82 million, Trichomoniasis with 156 million, and Syphilis with 7.1 million new infections annually. To help you visualize this scale, if STI infections were a country, it would be the third most populous nation on Earth, right behind China and India. These infections contribute to 2.5 million deaths each year globally. But here's what is truly staggering. These 4 curable STIs account for over 1 million infections daily among adults between the age of 15 and 49. We're talking about infections that can completely be cured with antibiotics, yet they're spreading faster than wildfire across the globe. The most terrifying aspect of this crisis, the majority of these infections are asymptomatic, meaning people are walking around living their lives, having relationships, completely unaware that they're infected and can transmit these diseases to others. Think about your social circle, your workplace, your community. Statistically, several people around you right now are unknowingly carrying an STI. Individuals who are infected may not be aware of their infection, but can transmit it to others and may develop long-term and potentially fatal outcomes, including cancer, chronic pelvic pain, ectopic pregnancies, and infertility. This creates a perfect storm of transmission. People can't treat what they don't know they have, and they cannot protect partners from infections they're unaware of carrying. Among all STIs, syphilis deserves special attention because cases have been rising rapidly during and after the COVID-19 pandemic. We're seeing what experts call a syphilis surge across multiple continents. But the most heartbreaking consequence is what's happening to newborns. There's been a surge in both adult and maternal syphilis affecting 1.1 million cases, and associated congenital syphilis, where mothers unknowingly pass the infection to their babies during pregnancy or childbirth. This is completely preventable with simple testing and treatment, yet babies worldwide are suffering permanent disabilities or dying from an infection that costs mere dollars to cure. The burden of STIs is uneven between and within global regions and countries. While wealthy nations struggle with rising rates despite better healthcare access, developing countries face the double burden of higher infection rates and limited testing and treatment resources. Some regions now show infection rates 10 times higher than others, often correlating with poverty, limited healthcare access, and social stigma around sexual health. This isn't just a medical issue, it's a social justice issue affecting the world's most vulnerable populations disproportionately. Here's what gives me hope. These are among the most preventable and treatable infections in medicine. We have the tools, the knowledge, and the treatments to stop this crisis. What we need is action. Every person watching this can be part of the solution. Get tested regularly. Make STI screening part of your routine healthcare, just like checking your blood pressure. Talk openly. Break the silence around sexual health with partners, friends, and healthcare providers. Practice prevention, use protection, and understand your risks. Support global health initiatives. These infections don't respect borders. We need worldwide solutions. We're living through one of the largest STI epidemics in human history, with over 1 million new infections every single day. But unlike pandemics of the past, we have the power to end this one. Every test taken, every honest conversation, every person who gets treated breaks the chain of transmission. This isn't about statistics. It's about real people in every country, every community, every family. The person sitting next to you, your co-workers, your neighbors, and potentially yourself. If this video opened your eyes to the scale of this crisis, hit that like button and share it, because awareness is the first step towards change. Subscribe for more global health content that matters, and let's work together to make 1 million infections daily a statistic of the past, not the future.